This story, guys, if you see the veins popping out of the side of my forehead here, forgive me. This one, I get pretty angry about this story the more I read into it. Travis, if we could we share my screen here? If you've followed my channel, you may have heard this anecdote at the beginning before, but there are some new developments in this story. So please, stick around for this. What you're looking at here, this is Sungida Rashid after giving birth. She's here with her family, with her husband. And sadly, shortly after giving birth, Sungida Rashid died. She started to develop internal bleeding in her liver, and she was prepped for surgery. And as they were prepping her for surgery at the hospital, there was a problem. The doctors that were about to operate on her realized that they did not have this. This is a coil embolizer, which is it's basically a device that goes up. My cousin, the surgeon, was explaining how this works to me over vacation. My cousin is just an incredibly bright, talented, amazing individual. He's a trauma surgeon, and he was describing how this works. This goes inside your blood vessels and can be used to basically stop the bleeding, to close off a blood vessel, even inside an organ like the liver. And well, the hospital where Sungida Rashid gave birth didn't pay its bills. And she didn't know that when she went in to have a baby, that the vendor that sells coil embolizers came into that hospital a few weeks earlier and repossessed all of the coil embolizers that the owner of the hospital hadn't paid for. And so as they were prepping her for surgery, the doctors realized they didn't have what they needed, so they decided to transfer her to another hospital, and she bled to death while waiting. And so this hospital management team killed her with what do you want to call it? Negligence, fraud? I don't know what you call it, not paying your bills. This family was torn apart because of that. And this hospital was the same hospital that owned this case, this story. This is somebody posted this on Facebook about the Rockledge Hospital, saying, my grandma's in the ICU at Rockledge Regional for a stroke, and the sink in the room 4 feet away from her is full of standing black moldy water, and her entire room smells like sewage. This is at the ICU, the intensive care unit. Any idea who I can call and complain to? It doesn't sit right with me. Raw sewage sitting in a sink, and you can just see in the picture, there's an out of order sign placed over the sink. The raw sewage is still there. But it's okay, folks. It's totally sanitary and medically safe because somebody put an out of order sign handwritten over top of it. Both of these hospitals were owned by this company, Steward HealthCare. And if you live in the Boston area, you have almost certainly heard of this one because this company has been making news internationally recently. And let me just tell you, the socialists are circling like buzzards over this story. So pay attention because we are going to hear more about this one as time goes on. Steward HealthCare bought these hospitals several years ago. And they were formed by a private equity firm called Cerberus Capital. And Cerberus started buying up hospitals around 2010 after the GFC. And shortly after buying up all the hospitals, Cerberus Capital took their payout and they spun off a company and called it Steward HealthCare. Steward HealthCare now owns all of these hospitals that this private equity firm created or bought. And what Steward HealthCare did is they entered a sale leaseback arrangement. And they did this with a company called Medical Properties Trust. All right. Now, these are the two companies, Steward HealthCare and Medical Properties Trust, that are at the heart of this scandal. All of these hospitals owned their buildings and, they operated, they had their expenses and they had their income and they were treating people. Steward HealthCare comes in, buys up all the properties, and they sell the buildings to Medical Properties Trust. And then Medical Properties Trust rents the hospitals right back to Steward HealthCare for several $1 million a year. So what happened where previously you had a hospital that owned its own building and could therefore just operate in it, now those hospitals are burdened with hundreds of millions of dollars a year in rental payments to this Medical Properties Trust company. It's called a sale leaseback arrangement, and it's one of the ways that private equity firms are going around the country strip mining companies, and in this case, hospitals. This is also the same phenomenon that bankrupted Red Lobster recently. A private equity firm came in and bought up Red Lobster, sold all the buildings, and then the franchise owners could lease them back And of course, one by one, it just bankrupted the company. That's exactly what Steward and Medical Properties and Cerberus Capital did to these hospitals over the last 15 years or so. And ultimately, it is now culminated in this story. Steward Health, the nation's largest physician-owned hospital operator, files for bankruptcy. This was back in May that Steward officially filed for bankruptcy. And let me just say, this physician-owned hospital operator talking point, Steward just loves to talk about this. That is a freaking joke, because here is the physician that owns most of Steward. This is the CEO, Ralph De La Torre. All right, Ralph De La Torre, who took the Hippocratic Oath, I would mind you, who's promised to never do any harm. Let me remind you about Sungida Rashid and the family that was torn apart by his business decisions. Ralph De La Torre is the CEO of Steward HealthCare. And, well, let's just see how Ralph De La Torre is doing. While his hospitals are going bankrupt and while people are dying because he didn't pay his bills, well, there's Ralph De La Torre's boat, the Lady Sheridan. This is the $40 million yacht that he owns. Look at the dinghy on his boat. Well, first of all, his dinghy has a dinghy. There's his 3 outboard engine dinghy that is carried inside of this freaking yacht as he drives around the world, providing affordable healthcare for people from this yacht. This is the living room on Ralph De La Torre's yacht. That's the living room on his boat. All right. So while this guy is bankrupting this company, while he is bankrupting these hospitals, he's also paying himself tens of millions of dollars in dividends. He is strip mining these hospitals, making himself rich, and people are dying because of it. And now that Steward is filing for bankruptcy, there's all big questions about government bailouts of hospitals in and around Boston, because this company Steward owns more than a dozen hospitals in Massachusetts, and they're all going bankrupt. And so now the question is the government going to step in and bail out these hospitals? Well, then wouldn't they essentially be just bailing out Ralph and his yacht? If Ralph De La Torre strip mines these hospitals and buys a boat and then the government makes up the difference, well, then guess what? The patients and the taxpayers ended up paying for this boat, didn't they? And then you end up with stories like this. Cancer patients devastated after Steward closes specialty cancer center in Brockton. They're closing hospitals. There are towns now that don't have hospitals because this company came in, strip mined them, bled them dry like freaking vampires, sold everything they could, and then the hospitals got so bad that they had to shut down. And this didn't just happen in America, guys. This is an international case. We've even got this one, Malta's former Prime Minister Muscat charged in connection with hospital sell-off scandal. This company, Steward HealthCare, they actually went to Malta, the small European island country, and they bribed politicians to sell their hospitals to Steward HealthCare so Steward could operate them. Now they have government-run healthcare in this country, so Steward was basically the government contractor that was hired to come in and run the hospitals. And of course, Steward did what Steward does. They ran them into the ground. They stripped them for everything they could. And now this small island nation in Europe, all their hospitals are going belly up because this American private equity firm bled them dry. And they were bribing politicians in order to get this deal through. Really just everything you could possibly hate about the medical system is so neatly packaged up and bundled up into this story. And, that was like a fast forward of what happened for the last few years. But then just this week, the story broke, and it adds a whole new layer to this one. We got this story. This is in, what's the name of this country? The Organized Crime Reporting Network, or I forget what this is, but this website, this story was in several different news outlets this week. U.S. healthcare firm embroiled in Malta corruption scandal spent millions on private spies. Now, again, this isn't just the Malta corruption scandal. They also did this in the U.S. But again, keep in mind, this woman who died at this hospital after giving birth, this family that's torn apart because Steward HealthCare did not pay for the coil embolizer that they needed to save her life. But they did have $7 million to hire UK-based intelligence firms that conducted surveillance and disinformation operations against its critics and even one of their own employees. The fees were billed to Steward's Maltese division, which was largely funded with taxpayer money. So this company was being investigated because of this corruption scandal with the former prime minister that they had bribed to be able to come in and buy up these hospitals. And there was a short selling firm called Viceroy Research that did an expose on Medical Properties Trust. They very famously took out a short position against Medical Properties Trust, exposing this corrupt relationship between Steward HealthCare and MPW. And rather than pay their bills, Steward spent $7 million to hire retired British special forces to surveil, follow, investigate, and even manufacture compromat against the regulators and the short selling firms that were digging into their dirty laundry. They couldn't pay for the coil embolizer to save Sungida Rashid's life, but they could pay $7 million to have ex-military follow their critics around. I mean, this story is gross. Let me just read you a little bit out of this article. A U.S. healthcare firm, that's Steward, at the center of Malta's biggest ever corruption scandal, authorized a spare, no expenses private intelligence operation, including one that targeted Malta's former health minister with what appears to be a fake, compromising bank statement. Leaked corporate records show Dallas headquartered Steward HealthCare was awarded a 2.1 billion euro Maltese government contract in 2018 to renovate and manage 3 public hospitals. But when allegations of fraud and corruption threatened its cash-strapped business, Steward hired private spies at 2 London-based intelligence firms to deal with its opponents, the records show. Practices undertaken by these firms included leaking fabricated bank records, accessing sensitive phone data, planting fake media stories about corruption by Maltese officials. In one case, corporate spies secretly filmed an opponent inside his own home and followed him when he dropped off his child at school. The operations racked up bills of more than $7 million over more than 6 years and were coordinated by senior Steward executives who corresponded regularly with private spies, according to emails, encrypted messages, and financial records. These guys, I mean, let me scroll down a little bit here to show you. This is a picture. This is a screenshot. It's a little fuzzy, but that is a picture of a guy named Fraser Perring, who runs a short selling firm called Viceroy Research. Now, these guys were also the short sellers who blew up the story on Wirecard, one of Europe's biggest ever frauds. And this company that he was investigating, he took out a short position on Medical Properties Trust because of their corrupt relationship with Steward HealthCare. And rather than run a better business, rather than paying their bills, I don't know, rather than maybe this guy selling his freaking yacht, they decided to hire $7 million worth of British special forces retired to follow Fraser Perring, to take pictures of him in his house while he's watching TV with his wife, follow him when he dropped his kids off at school. And there's stories, Fraser Perring saying his home security system, his CCTV stopped working. He came home, found his door open and his computer turned on. I mean, this is reading like a crime novel here. These guys hired ex-military, to try to manufacture fake evidence against their opponents. And, you know, all the while, this is going on in Malta. This is going on in the States. People are dying. Hospitals are going belly up. And I tell you guys, just take everything you hate about our medical system and everything that is so wrong about our medical system, and it is just perfectly packaged in this story. And you need to pay attention to this because, again, the socialists, the people who want the government to come over and take over every facet of healthcare, are watching this story, and they want this story to go national. They are going to use this as an example to make things even worse, in my opinion, by turning the whole system over to the bureaucrats that we just got done talking about in the Chevron deference story about how damaging that could be. So pay attention to this one, guys. And again, sorry if the veins were sticking out of the side of my head there. This one,
fantastic, really fantastic story, Jack, and such a great find about that Malta connection. So I kind of want to make a couple of connections here. One, Cerberus. So for those of you who follow me, they are the private equity firm that bought my company from General Motors. We were the lending arm of GM at the top of the last crisis. They then demanded a purchase price adjustment, which is why because they could see the market was turning after, they read some of the reports I sent them. But they could see the market was turning. They wanted a purchase price adjustment. And so that is when we started our write downs which led the write-downs of the entire industry and mortgage. So all those write-downs of mortgage-backed securities, things like that. In The Big Short, it gives a nice little narrative, but in reality, that Cerberus purchase is what really instigated a lot of the issues. And who is Cerberus? Well, at the time, my CEO that came over was from Bear Stearns. You look at the people at this company, they all should have gotten in a ton of trouble during the last cycle, but they didn't. We know people didn't go to jail. But ultimately, how did they get out of the whole mortgage issue? We got TARP funding at GMAC, and they were able to divest their ownership at a decent price. And what else happened? They didn't learn their lesson. They just took what they learned during the GFC about how they could get in an industry, cozy up to the government and be okay. And so that then led them to perpetuate what they did in the healthcare industry. And there's a great book for those of you who haven't read it, but called Plunder by Benjamin Ballew, who's an acting attorney general right now. They allowed him to print this book, and it talks about what private equity has done to this medical space. And when thinking about private equity, guys, I think we often need to think about government contractors, which is another thing that Jack was talking about. Because what did BlackRock do, for instance, in the last crisis? They came in and managed distressed assets for the government. So a lot of this private equity sits at the crossroads of government grift, and they do that on purpose because they know at the end of the day that's going to save them to some extent. Now, so that was not a question, Jack. That was a I will ask this question. So we see that this is happening. We also have seen with Obamacare, government getting more involved in healthcare. But so why is it then that Travis, who has good health insurance, for he and his family, went to the ER and had to pay $3,000 for his child to get checked out? So, we've had more government involvement. We've also had private equity, which is supposed to be all about, free markets. We know that's not true based on what I just said about the government grift. But so why are we still sitting here with healthcare completely unaffordable?
Well, I'm not going to say this specific thing has caused it, but if you're wondering maybe where the money went, why it's still so expensive, Cerberus Capital exited their position in Steward HealthCare in May of 2020 with a profit of about $800 million. They roughly doubled their money that they spent to buy the hospitals. They signed that sale leaseback with Medical Properties Trust. They doubled their money. They walked away with $800 million. And Ralph De La Tour and the leadership team at Steward HealthCare, when that deal was signed, paid themselves a $100 million dividend, $40 million of which went to pay for Ralph De La Tour's yacht. So while I don't necessarily know this policy decision will make Travis's trip to the ER cheaper, or maybe even, God forbid, improve the care that the kid receives at the ER, what a concept, right? I can tell you $900 million walked away with this private equity firm and these a-holes executives at Steward HealthCare, and what is left behind is bankrupt hospitals and patients dying waiting for care. All right, so that $900 million, that's where the money went. Now, I don't have the policy magic wand to save that. It sure as hell isn't the government come in and take over healthcare, because that's exactly what they did in Malta, and Steward went and ripped them off in Malta too by bribing the politicians. So, again, there's no magic, there's no silver bullet for this, if you will. But it's not hard to see where the money went. And the last thing I would point out, guys, is, the more we talk about insurance and, the whole Affordable Care Act thing, and, we're going to make healthcare more affordable. We need to stop associating health care with health insurance. They are not the same thing. And I would submit the biggest obstacle to care right now is insurance. How many bureaucrats do you need to hack your way through on the phone, in the office, before you can actually interact, see, or speak to an actual care provider? First, you got to get past that nasty person who answers the phone, that bureaucrat who needs to give you a pre-authorization and, I'm sorry, that's not in our network. You need to talk with your HR department. All these people who don't have anything to do with medicine are standing between you and the doctors. Every single one of them is taking a paycheck. Every single one of them is contributing to that $3,000 bill that Travis had to pay to have his kids see a doctor. End of rant.
Okay. So I have a question. I have a question for you. First of all, as far as the reaction to the story, I mean, man, I mean, betrayed again in America. Our medical system. I think our medical system, Jack, is one of the areas in America where, as a consumer and citizen, we want to have the most amount of trust. We don't want to ask these types of questions. I don't want to hear that some brand new mother passed away because the hospital was negligent. They didn't have something that was common. Now that child's going to be raised motherless. And so I'm getting sick of the betrayal, man. So, another thing I'm thinking is like, hopefully that Chevron doctrine that Melody was talking about, they do something about it. But the fact that we're now, as Americans, when I grew up, I never thought of things like this. But now as Americans, we have to question all of the things that we wish as Americans we could trust. It hurts. It hurts. And I know I'm taking a hit. I pay $12,000 a year on insurance premiums. And I still have to pay out of pocket $3-4 grand for my medical procedure. My child to go in, to the ER. She got a test, so I know it was a little bit more expensive. But this is a very, very sad day, because this is the transparency that Melody was just talking about with those laws being passed. But because I'm worried, man. I mean, we already have the transparency.
Well, let me
This
just
is a
tell you this.
story. But you just read the story, and nothing is. I mean, I know it takes time, but my God, man, I'm questioning if anything is going to change. But my question is for you, for the sake of time, Jack. I'm just going to get to my question. This is what matters to me. First thing I was going to ask is, where can people go to get quality care? But you're not a healthcare provider, so I'll just ask you this because you are an entrepreneur. The medical system's broke. It's unaffordable. I don't know how hospitals are going bankrupt when I have to pay so much money. Can a consumer first business plan, okay? We don't have the consumer first business plan right now, but can a consumer first business plan where the care goes to the consumer first before these hedge funds or before they're getting scalped like this? I mean, can that even, listen to me, Jack, with the way things are structured in the US, with how the greed and corruption and fraud is taken over, be realistic. Can a consumer first business plan even work? Won't that just bankrupt the healthcare system even more? Is there even a solution here? I mean, seriously, man.
I'll tell you who that system would bankrupt. That would bankrupt Ralph De La Torre. It would bankrupt people like Farmer Bro Martin Shkreli, that unbelievable epic dirtbag who bought the rights to an age drug and then raised the price 15,000%. He was just basically stealing insurance premiums from people. All right, that's who a consumer-facing healthcare system would solve. And I've wondered this myself because I'm trying to get treated for, I hurt my back. I'm trying to get through insurance and everything. And they just look at you like numbers. Nobody cares about quality of life or anything anymore. And I just wonder if there were doctors or hospitals who just said, you know what, the hell with insurance. We're not dealing with it anymore. Here's what we do. Here's how much it costs. Pay or don't pay. And no more of this pre-authorization and this in-network, out-of-network. And think about how much money you're paying for insurance and how much money of our tax money is paying for it via Medicare and Medicaid. And who's really benefiting? The dirtbags. It's not the doctors. A lot of doctors, Steward HealthCare hasn't paid a lot of their doctors for patients they saw years ago still. These guys are still waiting to get paid. So the doctors aren't making the money. The nurses aren't making the money. The patients sure as hell aren't getting better care. The pharma executives who are manufacturing drug addicts with what they did with the opioid crisis, they're getting paid. The insurance execs are getting paid. Ralph De La Torre is getting paid. So, I'll be honest with you. I think it really is, we're in a situation where it's like tear the whole thing down and start over again. Start with a doctor selling directly to the patient and cut out everybody else. And just see what happens. That is how medicine worked right up until the last few decades. That is how it worked back then.
Do we have time for one question? Jack, you good?
Yeah, I got time for a question.
I thought you were mad at me. You were ignoring me.
No, I'm not mad. But this gets my blood up. I mean, like I'm like flush in the face right now. This story makes me so angry. A woman dying after giving birth like that. It should be a happy moment, and it ends up being one of those like just life, family wrecking events.
So there's a comment, and I think this is a really good comment, and there's a lot to talk about here.
Yep.
Don Peterson, if you took the profit, because socialize, right? Let's take the profit, so they put the consumer first. Let's make laws or whatever, right? And how are they not making profit with how much money I'm paying so much money in medical? I don't understand how they're not filthy rich. But anyways, if you took the profit out of the medical system, you would lose the incentive for innovation, which is a fair comment.
It's
but
right.
They're also acknowledging greed is the problem. So on one hand, you got to let them be greedy. So there's innovation. What do you do, Dak?
I don't
want to comment on that.
Greed is a human condition. We're never going to solve greed, right? It's part of us. It's one of those things that's built into us that we all like to point fingers at other people and say they're greedy, but we all act in our own self-interest, right? And what animal doesn't? So greed is a human condition. That's not going away, not ever. And Don Peterson, I 100% agree with your comment. If you took profit out of the medical system, you'd lose the incentive for innovation. You'd lose the incentive for patient care, right? And oh my God, I've seen it. I've seen it firsthand as a first responder. I've gone into places where seniors are abused. I don't want to get into that. But I can tell you what we're seeing here, the profit is not going to the care providers. The profit is not going to the innovators, right? I have no problem if a doctor wants to study his butt off to become like my cousin, the trauma surgeon. My God, he is a superhero in my eyes. What this guy did, serving in the military as a trauma surgeon, the rank that he achieved, and now what he does. I mean, he's a superhero in my eyes. He is awesome. He deserves every penny of wealth he has because of what he has given others, the value he has provided. The same thing goes to somebody. If someone innovates and creates a life-saving drug, they deserve to be set for life. Are you kidding me? They saved millions of lives. They should be rich, right? But that's not who's making the money. Ralph de la Tour didn't do 1 ounce of innovation. He didn't provide care to anybody. Ralph de la Tour violated his Hippocratic oath, and he let people die for his boat, right? And then he hired spies to protect that criminal racket that he had created. That MFer, pardon my French, guy, I'm really upset. That guy deserves to spend the rest of his life in a freaking cage for what he has done to people. There are plenty of people in jail who caused less harm than Ralph de la Tour and his like for much longer. There's plenty of people serving life sentences who caused less harm than he did. If he comes out of this not in a cage, then our healthcare system is as broken as our justice system.
It's like the worst of both worlds right now, right?
It really is. But I do agree with that comment. I'm not for taking profit out of medicine. People who provide a service and a product deserve to be compensated for it. But it's not. We need to figure out a way to protect against the leeches and the vampires, because they have become such a destructive, parasitic influence on the healthcare industry. We got to get them out somehow. They need to be carved out.
Melody?
No, I mean, I just would agree. I've just seen so many examples in my own life of how this has really gone awry, and people haven't gotten the care they need. And it just seems to be that in all these instances where we think that free markets are operating, what we come to understand is it's mainly government. And you take the mortgage industry, that's exactly the way it is there as well. There 85% of all mortgages are owned by the government, guys. And then so the people that service them, they are essentially working for the government. So then you need to have an agency like the CFPB, because you as a consumer don't get to choose who your mortgage servicer is, because basically they're working for the government. And so, I mean, this is just all, you can just see how much all of this is excessive administration has just, caused all of this crazy price inflation in mortgage and housing and in the medical field. And so it is a complicated topic, but it's one that we have to talk about. And I agree with Jack. I mean, at this point, it just doesn't make sense anymore to pay a medical premium like you're talking about, Travis, $12,000. That, then when you go to the ER, I mean, and pay $3,000, I mean, that's insanity. And that's the one thing when I think about deflation, right? We're absolutely we're gonna see it, in my opinion. But I think about insurance, and I think that's one area where I just don't see prices coming down unless there's a complete upheaval of the system.
All right. Anything else, Jack?
I would just say take the whole healthcare industry, start to finish, the whole freaking thing. How many of the people are actually providing care? And I think it's a warning sign against bureaucracy. And that's my biggest warning with this story, is that the socialists are circling overhead. As bad as Ralph De La Torre is, as bad as his kind are, just wait until the socialists take over the healthcare system. And they're going to point to this story as an example of a reason why we should give them more power. Look, you got government-run healthcare in Malta, and Steward was able to rip them off too. And then they're hiring military guys to spy on anyone who calls them out. I know. This story is scary, guys. There should be a movie about this.
Right. And one thing I'd just like to say for these, socialist adopters is you go back and really study socialism. And what it's about is the government saying you're not smart enough to make your own decisions. And so when you think about we have to come in and we have to have this excessive government and we have to take control so that, private actors won't do what exactly Jack has just showed us. Well, guys, that's about saying you're too dumb to figure out how to choose the right doctors or how to choose the right system, or and is this system completely crazy? It sure is. But the socialism is about taking away your rights because they don't believe that you're smart enough to make those decisions for yourself.
Okay. All right, guys. I think we're moving on.